we all have a voice. We all have a degree of power and influence, and there are different ways that we can use it, whether it's social media, whether it's writing. But I definitely think that we have to be our patients' advocates, and there are people who are listening and watching.
Hello, everyone. It's Dr. Erkeda here, and I am super excited because we have a fabulous guest, and we're going to have an amazing discussion today. We have Dr. Uché Blackstock on the show, and I'm just going to give you an opportunity to tell us a little bit about yourself and your journey to medicine.
Oh, sure. Well, first of all, thank you so much for having me, and thank you to everyone who's listening. So I'm a board certified emergency medicine physician, and I'm also the founder and CEO of Advancing Health Equity, which is a consulting firm that I started almost 5 years ago. I can't believe it's been almost 5 years, but almost 5 years ago to work with healthcare and related organizations, specifically around bias and racism in healthcare, so that we can help close the gaps in the racial health inequities that we see in our communities that were exposed and worsened in the pandemic. So I've been busy doing that, and I have a book coming out, Legacy: A Black Physician Reckons with Racism in Medicine, where I talk about being a second-generation Black woman physician, which, as we know, is rare and should not be rare. But I use both my mother and my own experiences to talk about racism in medicine and in society that impacts Black health in very, very detrimental ways that we know about. So that's just a little bit about me.
I love that. And for the students who are listening, I think it's very important because a lot of times, we know our why and why we go into medicine, and it may be influenced by family members or experiences that you have. And you went into emergency medicine to help people. And I'm sure through your training and through working through your career, you saw how broken the system is and how many health disparities there are. And it just shows that sometimes you can do things outside of the box to kind of help fix the system. So you created your organization, and now you're talking about it so that we can arm more people with knowledge so that we can all go and fight for it.
Right. Yeah. And also, the journey that I've had in medicine was a journey that was unexpected. And what I recognized when I was in academic medicine, so I thought I would spend my entire career in academic medicine. My mother was in academic medicine. I thought, just to be able to teach and do research and work clinically, just being in an intellectually stimulating environment, that I would be happy. But what I recognized was that, like so many of these academic institutions out there, they're often very toxic to us as Black physicians, Black students, trainees, especially Black women. I realized that I was actually in misalignment in that environment because I was not able to be myself. I was not able to do the work that I wanted to do around health equity and DEI authentically. And I ended up feeling undervalued and underappreciated, which is something that I think people would say, what? Like, you're a second generation physician. You went to Harvard undergrad, Harvard Medical School. You were at an academic institution. You had multiple titles. By all appearances, you looked like the picture of success. But the fact was, I was actually deeply, deeply unhappy. And I had to make a decision for myself. I always say, take a leap of faith in myself, because I said, what, this situation is a situation where I am not taking care of myself, where I'm feeling like I'm under a microscope. And I started thinking about what else I could do. And I had assumed this DEI role at my previous employer, and I came to figure out that it was just a figurehead position. They didn't actually want me to do anything. So I actually started to do work outside of the institution. And by doing that, I actually started to make a name for myself. People were inviting me to give trainings, to give talks. And then I made the decision. It was a difficult decision. I made the decision and said, I'm not only going to leave this academic institution, I'm going to leave academic medicine. And I'm going to focus on my company. And then I spent part-time working in urgent care because obviously I had to pay the bills. But my goal was, in 5 years, be able to run the company full-time. And it happened actually within a year. And what happened was, it was the pandemic. The pandemic I started my company before the pandemic happened because I saw we knew these issues were out there, racial health inequities. They were exposed even more by the pandemic. And what I did was I just stayed in alignment. I started writing about what I was seeing in my clinical practice, that I was worried that Black and Brown communities were going to be the most impacted by COVID. And I became one of the first people in the pandemic to talk about these racial health inequities. But I was just doing what felt right to me, what felt in alignment, just to raise alarm and to amplify these issues. And then I became an MSNBC medical contributor. I was being interviewed for a lot of different articles. Interviewed on the radio, and my book agent heard me one day and said, I think you have a story to tell, and I think you're the only person to tell this story. All that to say is that I think it's so important that, and especially talking to the students and residents, that, there are multiple ways that you can live authentically. There are multiple ways that you can have an impact, especially as a physician, especially on our communities. And I hope that I can serve as an example to them that there are multiple journeys, multiple paths that you can take to live your truth. And I think that is so important for us because we often are not able to, because we're in these environments that are oppressive and don't allow us to be ourselves.
I couldn't agree more. And I'm not going to bore the students with my story over and over again, but there were so many key points that you can identify where you have this trajectory and vision for yourself, and it's kind of all you see, and it's how you train. You only train in academic medicine, so that's all they talk about, and they don't encourage different things. So I'm a primary care physician, so they're like, work for an organization, work for school, do all of those kinds of things. But there's more out there, and there are more ways to be yourself, and you don't have to fit into a mold. And for those who may be in training or in school, you don't have to listen to those naysayers. There was a time when I was a medical student on my internal medicine rotation, and one of the attendees came and they were talking about what are your goals? And at the time I wanted to go into academics as well. So I was like, academic medicine. And they were like, well, what's your plan B? Because number one, you're a woman, and number two, you're a minority. So it may be difficult for you. If these are what your leaders are telling you and they're trying to encourage you,
Right.
be a better way. So I love that this is your mission and that you have decided to share your story with us. As you mentioned, you're an author and you just released your memoir entitled Legacy. So we talked a little bit about what inspired you to write the book, but can you tell us a little bit more about it?
Yeah, it's interesting because, growing up with a mother as a physician and a mother who was a community leader. So she often would take us to the local Black physician organization meeting. She was president. I thought that most physicians were Black and they were Black women. So that was my reality growing up. I didn't recognize until I was a teenager that was not the case, right? That we are just a little bit over 2% of all physicians. And so, I think that was very shocking to me, recognizing that, and then being in these environments, these predominantly white environments in college and in medical school, that kind of were just I was like, what is going on? It was more, as a practicing physician, recognize what were the barriers that were keeping our numbers low. The reason why that there's so few of us, and not because we are not accomplished, not because we are not brilliant, not because we don't have anything to contribute, but because there literally are systemic barriers all along the way preventing us from becoming physicians or health professionals and working in service to our communities. And so one thing that I wrote about in the book was the Flexner Report, which is something I think that, I didn't learn about until the last few years, but the report, around the turn of the century, in 1910, that the American Medical Association and Carnegie Mellon commissioned this white education specialist to establish, standards for all of the medical schools in the U.S. and Canada. And what it did was, it led to the closure of 5 out of 7 of the Black medical schools at the time. And 2 years ago, I read this article in JAMA that estimated that if those schools hadn't closed, they would have trained between 25 and 35,000 Black physicians. When I read that, I cried because I thought about the impact that those physicians would have had on patients and their communities. And it would have been exponential, right? So I thought writing the book was really important because I wanted to help, for multiple reasons, connect the dots for the general reading public about how we arrived in the situation that we arrived in today, where we don't have a diverse workforce and where, Black pregnant people are 3 to 4 times more likely to die, where Black infants are twice as likely as white infants to die in their first year of life. Like, this is not because of anything inherently wrong with us. This is because of systemic issues like, housing policies that have led to chronic disinvestments in our community, things like the Flexner Report. And we're seeing the culmination of, and even, chattel slavery, just like the lack of generational wealth. We know all of that. Wealth impacts health. So I wanted to use the book as a way of sharing my experiences. I'm actually able to share some of my mother's experiences, even though she passed away when my sister and I were 19 years old. But she wrote an essay in a book called Women in Medical Education. So I still have her words, able to use some of her words in the book to show that even though all this time has passed, we still are confronting a lot of the same issues. What do we need to do about them? What do we need to do to move forward? I feel like a lot of these conversations we have in our silos, like within academic medicine or among Black physicians, and we really need to get this conversation out into the mainstream so that people understand, like, what is it that they need to do, right? I want to affirm for Black patients that this is not their fault, that the system is broken and that they deserve so much better. I want to make sure that white health professionals and other professionals of color understand that, the way that they don't listen to our patients, that impacts outcomes. I want them to understand how systemic racism impacts our communities and ultimately our health. So I wrote the book just to help people connect the dots in a way that is easy for them to understand.
I so appreciate that because I think that you are correct. Like, we have these conversations in silos. And as you mentioned, Black physicians, Black women make up about 2 or 3% of the healthcare workforce in terms of physicians. And it's only about 5 to 6% total between men and women. The same for Latin communities and even less for communities like Native communities and things like that. So we have to bring everyone along in the story. We can't just do it amongst ourselves. Like, if we are making up the 5%, who's making up the 95 who are caring for the rest of the country?
I know, exactly. And I always say, like, okay, yes, we need to increase the diversity among health professionals. But at the same time, we need to make sure that other 95% is able to competently care for our patients and understand it's not just about listening. It's not just about understanding and appreciating, but understanding the context in which our patients live in their communities, like how they work, where they pray, just like understanding all of that. So, there's this idea, we talk about cultural competence, but I love this idea more of structural competence, understanding how structures, policies, systems, systemic racism ultimately impacts the social determinants of health, which impacts the health outcomes that we see, and really demanding that health professionals understand that when we see illness and disease, that is a manifestation of what is happening in our society, right? Like, that's not necessarily, we know that it's like what I said, more than 70 to 80% of what determines how healthy someone is beyond their control.
Absolutely.
So that's something I wish I had learned in medical school. Like, I feel like that public health perspective is so important, but in medical school and in medicine, there's this emphasis on, the clinician-patient relationship, and you're not thinking more holistically. I think it's imperative. It's imperative that we have that context in terms of how we're interacting with our patients.
It's definitely imperative. And I love that you brought up, like the CDC says, like 80% of your health is determined like outside of the healthcare system. So it's all of those different things that come together. And I feel as though now, especially like during the pandemic and after like George Floyd and all of those kinds of things,
Right.
we're throwing out buzzwords and we're trying to do things like social determinants of health, which are true, but when you take a step back and you think about it, it's common sense.
I
Yes,
know.
where you live kind of determines how healthy you are. Can you go for walks? All of these things, your finances, like these are all common sense things, but it's more than that. There are layers to it. There are political
Right.
determinants of health, like politics matter. Like we try to separate it in medicine, but we shouldn't.
Right.
Like
No.
we've seen how it's gone with like abortion, and now they're looking at other medicines and things. So we have to work to educate so that we can change. So like you said, you wish that medical education was a little different. So you have a chapter in the book called All the Things They Didn't Teach Me. And it dives kind of into the historical context of like the health disparities in medicine that we don't receive enough education on. If you were in charge of creating a medical curriculum, how would you suggest that they incorporate those lessons?
Yeah. I mean, I feel like this is even content that should be taught before medical school. K through 12, like I would talk about, the ACEs, adverse childhood experiences. Like these are things that like teachers, caregivers, educators should be thinking about, right? So I feel like, and incorporating that in curriculum, like even K through 12. But even so, in medical school, what I would love to see is that, these topics are not siloed that there's like, a course on health equity, or there's a course addressing systemic racism. Like it needs to be integrated in all aspects of the curriculum. It needs to be part of the mission of medical school curriculum that we are discussing, addressing, challenging our students to think about how do we solve these problems. A lot of it also is faculty development. Like a lot of faculty, they were trained, in more traditional times. So I think it's a combination of making sure the curriculum represents the content that needs to be taught, making sure that the faculty are equipped continuous faculty development around how do you teach about health equity? How do you teach about anti-racism? How do you teach about social determinants of health in medical school? I think that's really important. And then I also think that, I know the AAMC came out with some, they call it DEI competencies last year about like what medical students, what trainees, what faculty should accomplish, right? Or the criteria that they should fulfill. And that was like voluntary, some schools could use it, some schools couldn't. But I do think like we need to, like, that should be part of the LCME, like for schools to maintain accreditation, there's certain health equity, anti-racism, DEI competencies that they need to fulfill. So that needs to be in the curriculum, that needs to be in faculty development. And I think also in every single role within medical schools, like there should be those competencies that staff, leadership need to fulfill. So it can't be an afterthought. That's most important. It cannot be an afterthought. And it's been an afterthought for too long.
I couldn't agree more, because if we're going to ingrain it in the system, it shouldn't be something that's just a checkbox or something you talk about on Black History Month or those kinds of things, even with certain organizations. That's a lot of times.
Right.
They call the Black physicians to come and talk about something to their staff. It shouldn't be that way. And I love that you mentioned that it should kind of be integrated from early on, because whether or not you go to medical school or not, like you're going to engage with the healthcare system,
Right.
and your loved one is going to have to go. You should learn about things that make you healthier and more than the basics that they teach you in health class. So I think that that's very important, and hopefully over time we can push to move that forward. Speaking of moving forward, you have another chapter called A Way Forward, Actions Speak Louder Than Words, where you kind of put out a call to action to many groups and see how we can influence the healthcare system. I love this because I feel as though medicine is very, very siloed. So I work in healthcare technology, where we have the clinician community and we have like engineers, and they speak totally different languages, and it goes throughout the whole system in that way. And I just feel as though if we borrowed more ideas like other people do from other industries, from other professionals, just because it's not only going to come from us, we would kind of move things forward. So what are some ways that you think that people from different walks of life or different professions can do to create a more equitable system.
Yeah, it's interesting because like just like you were saying about like the clinicians and the engineers speaking different languages, it's like I think a lot of what the work that we do as physicians or health professionals, like we need to be interacting with people in other disciplines. So even like urban planners, right? Thinking about public spaces, right? Thinking about urban design, thinking about how, because we know that green space, right? Or just people having the ability to be outside safely, that impacts health, right? So I think that like there needs to be more opportunities for us to interact with other disciplines, even like sociology, other disciplines, so that we can better understand like what we need to do better for our patients and really get out of those silos. And in the chapter, I do make a call to different groups, right? I think I know what has the biggest impact, and that's the call to policymakers, because I think a lot of what we see is this chronic disinvestment in our communities, just as the legacy of slavery, the legacy of housing discrimination. Like the same neighborhoods that were redlined are the neighborhoods today that have the worst health outcomes for Black people and people of color, right? Over 100 years later. So I would love for policymakers to think about how can we be innovative in thinking about, I don't want to even say reinvesting in our communities, investing in our communities in various ways that will help improve health. And I think that as health professionals and as physicians, we have to understand our roles as our patients' advocates. I would love to see us get more involved in policy, that the work that we do is outside of our clinic, it's outside of our hospital room. It really is like, I think, up to us, because our patients, we know what's going on in their lives, or we should know what's going on in their lives. They tell us the most intimate, vulnerable things, right? We really should feel an obligation to be an advocate for them, one, and to be more involved in policy and lobbying on our patients' behalf.
I couldn't agree more, because if we aren't educating the policymakers on what's really happening, they're going to use their own interpretations, as we're seeing is playing out right now. Very interesting that you mentioned that, because I recently went to a conference and we were taught, it was a health equity conference for the Milken Institute, and they've done a lot of different things in terms of pushing technology, like helping discover like coded DNA and all of those kinds of things.
Yeah.
And they
Yes.
had a session where they talked about how, like, they had the group of, like, 50 amazing leaders in science come together with all of these great ideas, and they were trying to meet with the politician. And, of course, they weren't taking the call, but they had to get, like, the billionaire to call on their behalf on board, and they answered it, and they were able to move things forward. So how do we get into those spaces, and how do we get into those rooms? Because even looking at that, like, the people who are getting the meetings to even meet with the billionaires, a lot of those meetings are invite only and things like
Right.
that, where certain people, especially from certain marginalized groups, aren't always invited.
Yeah. I wanted to say just about that, so one of the things, like as I mentioned, I started to do at the beginning of the pandemic was writing about what I was seeing. So I started writing op-eds, and I had taken a workshop with an organization called the Op-Ed Project. And the whole focus is to get women and people of color an opportunity to share our perspective. I found out almost a year after several op-eds I wrote about COVID and how I felt Black people should be prioritized in the vaccine rollout and what we needed to do to get more vaccines to our communities. I found out that there was a policymaker, a representative in Denver, a Black woman who had been reading my op-eds, and they had informed some of the local policy that they created around the vaccine distribution. So all that to say is, like, anyone can write an op-ed, and it doesn't have to be in, the New York Times or the Washington Post. People will read it, they have access to it. So this is another way I want to share with the students and trainees that we all have a voice. We all have a degree of power and influence, and there are different ways that we can use it, whether it's social media, whether it's writing. But I definitely think that we have to be our patients' advocates, and there are people who are listening and watching.
Absolutely. I couldn't agree more. Well, we're almost coming to a close, but I do have one question that I would love to hear from you, just because you've had such a storied career. For those who are just in the beginning phase of their career, who are students, what advice do you have for them as they take on this new journey?
Yeah. I would say to be very, very clear about what your purpose is, what your values are, what your vision is, like from the very beginning, making sure that when you have the ability that you're in environments where you can thrive and not just survive, and always make sure that you stay in alignment. If things feel off to you, think about what are the possibilities, what are things that you can do to get back in alignment. That's so important for us, and to know that there are an abundance of possibilities and opportunities out there for us, that we are not limited to one journey, one path.
Thank you so much for sharing your words of wisdom. I'm just going to give you an opportunity to tell the students goodbye, as well as where they can find your book.
Yeah, so as I mentioned earlier, this book I wrote for the students and trainees. I'm so excited for you to read Legacy: A Black Physician Reckons with Racism in Medicine, and it is available anywhere you can buy books. It is on. You can go to your local booksellers and order it, or go to, I don't want to mention the A word, but Barnes and Nobles, anywhere that sells books. Legacy is available, and I hope that you will read it and feel affirmed and reach out with any questions that you may have.
Thank you so much. And for the listeners out there, I think that this is a really good book to take and just reflect back on, maybe bring it to your institution to see if they can encourage some more conversations. I had a preview, so I'm not just like making this up. So it's definitely something that I think everyone can learn from. For those who have suggestions on other topics that you want to listen to, or other people you want me to invite, just reach out to us on my Instagram at Dr. D Graham, DOCTOR, the letter D, GRAM. And we'll see you again next week with another fantastic guest. Bye!
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.